The Vascular Society's had a pretty busy year up to the sort of meeting at the moment. I think there are a number of things going on which will probably take up a lot of my time in the coming year. There's been the publication of a number of documents this week, which I think will end up being very important in terms of the care of vascular patients in the next year. So the first of those is the new provision of vascular services document, which really sets out how we should run vascular networks and how we work with both patients and clinicians to try and improve patient outcomes. So I think that's going to be a very important document, and disseminating the work in that document, which has been extensive, I think will be very beneficial to vascular patients going forward. So that's one. We've had obviously a very difficult couple of years with COVID, as most people have in terms of healthcare. One of the interesting things about the NVR annual report, which has been again published in the last couple of weeks, was that the number of cases we did last year during COVID dropped off significantly. So there's about a 30% reduction for some of the index arterial operations we do because of COVID. And so there will be quite a lot of work, I think, in the next year in terms of COVID recovery. So treating some of those patients that weren't treated because of COVID or haven't been treated because of COVID. Interestingly, some of the other things that happened is that some of the things that perhaps we didn't treat so well, so some of the lower limb arterial disease, peripheral arterial disease patients, as a result of COVID, potentially were treated more quickly. So one of the big things for me going forward is trying to improve the pathways for those patients. So the people with critical limb-threatening ischemia, as you're probably aware, we're running a quality improvement program for lower limb ischemia. That's been running for 2 or 3 years now. We're very fortunate to have a couple of excellent research fellows who are working on that project at the College of Surgeons. We've got 13 early adopting centres trying to push that work forward. So I'd hope in the year ahead we'll have some good news in terms of improving the treatment pathways for people with peripheral arterial disease. I think the big thing from my perspective, hopefully in the next year, is some of the work we've been doing with devices, particularly aortic devices. So there's a real need, I think, to capture information about devices we implant in our patients. And we implant devices in lots of our patients, whether it's a stent graft or a conventional surgical graft. And we really need to get some more information about the long-term performance of those devices. So one of the things we did with the National Vascular Registry a couple of years ago was introduce a device capture for the aortic devices. And I think that's going to be something that's really important going forward. We'll hopefully be able to start seeing some of the early data from that data collection in the coming years. You're probably aware that there's quite a lot of concern, particularly around durability of aneurysm repair and keyhole aneurysm repair that needs addressing. And I think we'll be in a very strong position, hopefully in the next year or two, to start identifying why sometimes devices don't work as well as they're designed to work. So I think that's going to be a big thing in the next year, but certainly a big thing probably in the next 5 to 10 years in terms of aneurysm surgery, certainly. But I think hopefully we can work to bring that knowledge we've created with aneurysm surgery to the other areas of our practice. So we probably need to start looking at having some long-term outcomes for some of the other procedures we do, and particularly long-term device outcomes. And I suppose that's most pertinent in the lower limbs. So we're potentially looking at stents used for peripheral arterial disease and their durability and long-term performance. And I'm hoping that the work that we've already done with aneurysm devices we can translate and move quite quickly into some of the other areas, so the lower limb and potentially the carotid, where we implant stents or conventional patches that we probably need a bit more data on in terms of long-term performance.